Hi guys, thank you very much. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe this channel if you have not until now. And again, my job is just to make your OET very easy, and the same applies to NCLEX. We just want to make things easy for you. Being nurses, we only work for you. For the moment, we don't work in IELTS or PT. That means we work only for medical professionals. And this is what Dr. BKM is all about. So please subscribe our channel if you are a nurse or you are a doctor. Thank you very much. Now see, we are doing reading part A. Again, Dr. BKM does not create question paper. So highly thankful to the institute, whosoever has created this question paper. Really thankful. But again, my job is well concerned about how to make reading easy. So see, just again, the main thing is strategy, because in reading part A, everybody can find the answer. We all know you can find the answer, I can find the answer. So what's the problem? Problem is the timing. But the same fundamental of reading applies. Easy questions first. What do I mean? So you will read 1 to 7 questions. Okay, I'm trying to read 1 to 7 questions. I have not done this reading before. I'm just going to do how many chemicals are there in the cigarette smoke. Chemicals, how many? Number. Which chemical causes cancer? Now I have two. In the first, I had one keyword, smoke, and chemical was the main. Now in the second, chemical and cancer, two keywords. Nicotine levels in the breast milk, nicotine breast milk at peak. So I've got three keywords. Means keywords means the words which I can remember. It's nothing special. But yeah, in the first, I can remember chemical. In the second, I can remember chemical and cancer. In the third, I can remember nicotine levels. And you don't have to remember everything. In exam, it's going to be easy because you have papers. You can just flip over. In my case, it is little difficult on the laptop. How does exposure to passive smoking? Passive smoking is my keyword. How does respiratory function? Respiratory reflecting airflow is a big word. Side effects of neonatal. Neonatal is a very important word. I can say it different because it is other difference. There was nicotine level, breast milk. So I feel somehow breast milk, nicotine levels, then nicotine levels, neonatal. It can be in the same paragraph. What are the poisons in the cigarettes? What are the poisons? So I have got almost chemicals, poisons. Okay. Now you just have to go to the paragraphs in the final exam. Okay. First paragraph is about start EM yug, cigarette with your morning breast milk. Now, cigarette, breast milk. So I can do third or fourth question where breast milk was given, but still, let's see. US researchers, you don't have to read everything. Breastfeed, patrons, 15, age 2 and 6 months, occasions, 3 period, mothers abstain from smoking, women were asked to avoid caffeinated during the study. Study word is also given. And see, now if I don't do anything, I can see breast milk word. At peak, I have not found. So until now, I will not do. And study was also given, a passive smoking study. So if I can find the word passive smoking, if passive smoking is given, or peak word is given. So I cannot see anything like that. So I just can't waste my time. I will jump on to the next. This text B, test on the milk with mothers recently confirmed significant increase nicotine dose, sleep taken 3 hours average. Again, they are talking about breast milk, neonatal nicotine exposure. This word is final. Neonatal wala answer should be B. This is final. Okay, long-term behavior, sleep patterns, smoke want to consider planning, nicotine levels in the milk, peak. Peak word is also I have found that peak and neonatal I have found in this paragraph. So these two questions I would love to do. Means I'm not doing all the questions. I've read 7 questions. I'm trying to attempt them. And the neonatal 2 questions I'm doing. Okay. Now just follow simply. Don't take stress. What is smoked? Around 400 chemicals. How many chemicals? Question number 1. 4,000 chemicals. You don't have to. You just have to write A. One more done. Breathe near a smoker, quick clothes, hair, skin. Some of these chemicals are what kind of chemicals? Poisons word is given. The last question was about poisons. Don't remember? You don't remember? Why? What are the poisons? D again. D or C? What we doing? Just C. C, poisons. That is how you do it. Takes passive smoking and respiratory function. 2 more questions done. Passive smoking, respiratory function. Done. My questions are solved. I don't stress over. Now, see this method. You have to continue the same method. Don't break the sequence in the final exam. How much percentage of the sleep drops in the baby? I think it should be A or B. That is what is the benefit. Uh, Now, Royal Women Children Hospital 1 5. They're talking about weight, respiratory function, air trapping. You have to understand in which paragraph. Then again, there is passive smoking again. So now I am confused between passive smoking. Which one is the better answer? So then, when the answer is in the two things, then you have to correlate. How does exposure passive smoking in the study? So I need now I have got passive smoking at two places and study is done in this. So I will change my answer from of passive smoking to this one. Respiratory function is also mentioned at two places. So I have to again take care which one is the answer. Respiratory function was given in this only. Okay, then the answer is D only. Sorry, I'm not changing my answer. The answer we did D only. If that would have been C or D, then I would have to go deep. Never go deep in the first round. That is what I want to teach. 1 to 7. Suppose if C paragraph also had passive smoking and respiratory function, D also had respiratory, and then I will not try to do that answer. I will do it later. Because then I have to dig deeper. Where respiratory function, which respiratory, I have to match other keywords. If the answer is coming with one keyword, respiratory and this, then it's easy for me. Okay. Poisons we have done C, every question we have done. How much percentage? So I have to find something like percentage. So in this question, again, don't overemphasize. Just see where the percentage is given. This percentage, 79. Otherwise, percentage is given in A part. Was there any percentage? No. Percentage is given only in D part. Yeah. So that means answer should be over here. Now I will read the question. So first of all, see where is your question. Now question, how much percentage does the sleep drop in the baby who had significant nicotine dose? Significant nicotine dose. Okay. Significant nicotine dose should be given. No, I'm not finding it. Now this is where I'm wasting time. I have to leave this question. Just last try if I can see the percentage somewhere. No, I cannot see the percentage. That must be given maybe 40%. Yeah, this is the one. A drop of almost 40%. Now I'm doing this. If significant increase and the team found that this and it is given a drop. So answer is almost 40%. For now, again, I won't waste time. Even this is an extra time I have taken just because I'm recording this class. Otherwise, I will know if it's my final year. How much percentage of children at 11 was measured? How much percentage of children that was given 55%? See, a 77.9%, 11 years. So I wasted my time in that question, but this question saved my time. Be aware. Don't panic. Go. What was the maximum birth weight of the babies who were considered for the study? Maximum birth weight that would be given over here 1510 of C 154 consecutive surviving children of less than 1501 gram. Less than 1501. This is a smart question. That means maximum weight is 1500. Less than, this is where you have to, these are the brain. Less than 1501. What is less than 1501? 1500. So maximum is 1500. 1500 grams should be the answer. So just keep doing and go in the flow. Any question that is difficult, leave it. Which chemical component? Now see what is saving my time. Which chemical component reduces the oxygen, carbon monoxide? In the C part, it is given. I already know because I had very nicely scanned in which paragraph which would be given. In the A paragraph, there is about breast milk. In the second paragraph, there was something about again breast milk. Third paragraph was precisely about studies, scientific studies, and then chemicals were given. Third paragraph was of chemical. Fourth paragraph was of passive smoking and respiratory and weight. So this did not take any time. So you have to do those questions which are now which who recruited the subjects for monochemical senses study. Monochemical, I think that should be in the D part only. Monochemicals, but I cannot find it. So maximum I will see B. Monochemical, I cannot find it. US researchers, but monochemical. Yeah, I can see in A. So yeah, who? Who means who? I just have to answer who. Then researchers have found sleep altered geological senses in Philadelphia who smoked, sleep, this and this. US researchers, I think. Otherwise, this again, I'm saving my time. But I will read the question nicely. Who recruited the subject? I think researchers, but again, I don't know. Which chemical component is cigarette smoking? Again, this is easy. This is I don't want to miss in first round. Which chemical I know this. This causes cancer. But what causes heart attack? Heart related to heart, it should have been given over. This is carbon monoxide again. So again, it's not taking time. So this is how you do it. You just go according to the flow. Means any question that is out of the league, like this monal, I was considering simple. If I do not find it in the end, I will do researchers who recruited subjects. I think researchers is the only option. But see, it's taking time. So I have to be there. Who recruited subjects? Found altered sleep, just senses, Sylvan who smoked, sleep 3 hours on both the occasions, abstain from smoking. The women were also asked. See, it's so difficult to find this question. Suppose if I would not have left that question, I would have still been doing, oh, this who recruited, oh my god, who recruited, and my time is gone just because of one question. Leave any question that is difficult. Suppose in 50 in 10 minutes, suppose in 11 minutes, okay, not 10 minutes, okay, maximum 12 minutes. If you can do 15 questions, now you have 3 minutes and 5 questions which you have already read, out of which one or two will be out of 1 7, where you just have to write ABCD, and now you can easily define where is ABCD. So that is what saves time. But if you do all the 7 questions, if you do all the 7 questions, sir, I found all the 7 questions, but I could not save time. Sorry, my dear, if you have found all the 7 questions, you will never be able to save time, because that means you are giving time to all the questions. You will not be able to save the time. Out of the first 7 questions, maximum 5 would be easy. So in the first attempt, in the first 2 minutes, maximum 3 minutes, you need to do 5 out of 7 questions. That is the thing. Maximum 2 to 3 minutes. You can't give more than 3 minutes to first 7 questions. Then you will have 12 minutes and 13 questions to do. Simple. Out of which, when you will do now 1 minute, one question, you are much better, much safe. And also, you will break the sequence 8th, 9th, 10th. If 10th is difficult, leave it. Do only easy questions first. That's the only way of completing your reading. Part B and C also. Part B, first 6 questions less than 10 minutes. Part A, 1 to 7 questions less than 3 minutes. That is the rule to complete your reading on time. If you can do this, but that doesn't mean that after that, when you come to C part, you do all the questions. And you come to 8 question, then you have to do all the questions. Any question like this, which is difficult, leave it. Don't overdo it. Otherwise, you will be lost. If children are continually exposed to it, can lead to dash in respiratory function. It can lead to failure in respiratory function, but I think it should be in the D paragraph, because they were talking about respiratory function. I need the word children. What can it do? Children or active smoking word is actively smoking. Household numbers, most respiratory airflow was significantly damaged, but I need active word and children. Respiratory function lead to further deterioration. Active smoking word is, see, active smoking word is given, 11 years is given, further deterioration in respiratory function in these children. So this is my keyword. Means I'm not going deep, I'm going to the words. Active is given, see, again, I will make you see the question. You don't over focus. Children, continually is an important word. Active smoking, it can lead to in. Again, I told you in the listening, if you have listened, see, that is what is the problem. If you're listening to even 3 videos of mine, of one thing, like writing 3 videos, speaking 3 videos, reading 3 videos, if you have learned everything from it, you can't fail. Simple. If you are listening to my videos but are not paying attention, preposition are in. It can lead to dash in. These are the hints. Continually, ly, adverbs. Then I see the word if ly continually. So my word is there. Active, my word is there. Lead to in word is there. Preposition. This is what makes my thing easy. You have to take care of these things. Then you go to, and 8 to 13, 2 question will be difficult. 1 to 7, 2 question will be difficult. 8 to 13, 2 question will be difficult. 14 to 21 question would be difficult. These are the easy questions. During the study, some women were asked to avoid smoking. What else can happen? They were smoking only, no? During the study was given in D part, I guess, in B part or D part maximum. T or B? Study was in D part, but avoid caffeinated drinks. Some things are easy to find. You know A or D. You want to see where the study is. Dash of nicotine inhibit regions of the brain who control sleep. I need sleep and brain. Sleep and brain. It can be over here because they were talking about lot of organs. Sleep and brain. Nah, it's not given otherwise. Okay, over here, close. Nah. Sleep and brain. I need the word sleep and brain because I haven't seen it much. So I think I again have to go to paragraph. Sleep, but brain word I am unable to find. So that's taking time. So I will leave this question. Means any question, whether it's easy or difficult, but if I am not finding it, that is difficult. Simple. You don't have to say, oh, this was easy, this was difficult. When I am not finding it, that's it, that is difficult. So I will do this question later. And somehow when I will be finding something else, I will see the word brain somewhere. But yeah, but it should have been an easy question. Brain, sleep and brain should have been easy. Should be in the A only, I guess. But again, I have to leave it. Sorry, I can't stick to the same question. Then I have to see other keywords also. Dash can also stick to close. C part first line. So this I should do because I know this line. Then dash of nicotine inhibit regions. Okay, the relationship between respiratory and number of cigarettes smoked per day were analyzed by. This I can find easily in the last paragraph. Were analyzed by who? Analyzed by scientists, or it should be over here. Who analyzed? I think they will analyze over here. So again, I was thinking this is going to be an easy question, but Royal Women's Melbourne Hospital, but it should come or it should not, but setting is over there. Yeah. This paragraph I'm missing something, I guess. This paragraph, controlling sleep, brain. Thank God. Dash has been shown. See, I was trying to find other question, but neurostimulatory effects of nicotine, which has shown to inhibit regions. So this is my answer in this line. So by chance, I was trying to find other question. So then you can do again. That is again, I cannot find the by. But yeah, I will take your help. That's not a problem. My 15 minutes are over almost. But yeah, that's the method how to go about it. But see, I don't have pages which are easy to flip. I have computer which is very hard to go this and that. Then second thing, I'm teaching you as well. Still, I've done almost 16 to 17 question and still and rest I will take your guidance. You will help me. Okay, guys. I'm just gonna unmute you and now you can help me. So out of 1 to 7, how many questions have we done right? Generally asking 5 or 6. 5 or 6, I guess. How many chemicals are there? 4,000 chemicals was given in A, I guess, wherever it was given, or maybe in the C. Which chemical cigarette causes cancer? That was given in tar was causing the cancer. C was tar was causing the cancer. Or which nicotine level in the breast milk at peak? That we found in the A, I guess, when we were doing at peak.
B, sir.
B
B.
at peak was given over here, yeah. And then we did the rest. How does exposure to passive smoking was established? That should come in D. It can be anywhere, but active passive was lot of discussed over there. Passive smoking in D. I don't know the answer of this, but fifth is D for sure, I guess. Fifth is D.
Yes, sir.
Yes, sir.
Side effects of neonatal nicotine exposure should be in A or maybe in D. Side effects.
No, sir. B.
Sir, B.
B, sir.
Poisons is given in C. So sixth and fourth was little tricky question for me. So that is where I have to do it later. How much percentage? That was fine. 40%, almost 40%.
Yes,
Yes,
sir.
sir.
How much percentage? 77.9. That was given maximum weight 1500 gram. This was a smart question.
Yes, sir.
Which chemical component, carbon monoxide?
Sir, it should be 1501 or 1500.
1500, ma'am. See, I've got less than 101 rupees. So what is the maximum amount I have? I don't have equal to 101. I have less than 101.
Didn't get it, sir.
I don't have equal to 1501. I have less than 1500. 1500. That was a smart question. This kind of one question comes in the exam. Okay. Which chemical component, oxygen in the blood? That was again the same. Who recruited the subject? Is it researchers or what? I couldn't find it.
Sir, it's
No,
in
sir.
Julie
Paragraph 1.
Lanela.
Sir,
Okay.
text A.
Acha, the name was this one. I just okay. I just messed up with the name. Okay, who recruited this person? I couldn't see the name of any person. See, stupid. It's so easy. See, some questions are easy. Even then, you have to see it with patience, and then go along to the next. Nisha ma'am from New Zealand, please take care of your mic, please. So now next, then it's done. Which chemical component is responsible for the again? It was carbon monoxide, right?
Yes, sir.
Yes.
If children are continuing, it can lead to the same answer which we did in wala hai na. Second smoke can breathe in by near now don't forget this as well. These articles also has a very, I think 90% of the times a word would be given, and even near a, where is it,
Smoker, sir.
where is it given?
Sir, text
C
C.
text.
Near a,
Second line.
see, near a smoker. Articles and prepositions, my lord, in listening party and reading party. If they have been given, they have been given to make your work easy. Prepositions and articles. You can't miss them. This is what is the fact. So just go about them nicely and go through it. Then we did all the things. Dash of this we found in the end, na? Dash of this inhibit the brain.
Sir, text B.
We found it. We found it. No, we did inhibit. It was given over.
Yes, sir.
That was given right in the middle. Inhibit. What was the question again?
Dash of nicotine can inhibit regions of brain which control sleep.
A dash of off. Oh, sorry. Again, rules of preposition. Rules of preposition. Rules of preposition is applying even in this. Off word was given after the blank.
Yes, sir.
Yes, sir.
Again, this is how. Don't have to overthink. You don't have to understand meaning of every question. Sometimes it's just about preposition and articles. And the last, it suggests Manila explain why. Manila, what was the question in the last?
The
What was
relationship between respiratory function variables and number of cigarette smoker per day were analyzed by.
this is the only person that has been, but it should be in the D paragraph, right? To determine if an adult's passive smoking respiratory function.
Sir, D paragraph methods, last line.
Okay. B paragraph last line, this one.
No, sir, D paragraph
A D paragraph. That's what I was saying. It should be in the D paragraph, okay?
methods, last line.
Bilinear regression, okay. See, but again, but if I am alone, I can do it better. If I have pages, I can do it better. And I was expecting it to be in D. That is what I want you to be aware of. That where should it be? And that is why never start the question from question number 8. Because then your mind does not work like where would it be? When you do 1 to 7 question, then 8th question you also like, oh, it can be in the C. This is saving time. Oh, it can be in the D. This is saving time. It can be in the B. This is saving time. And if I use the calculator and if I say by this method, you save only 5 seconds. I think you save 10 seconds. But still, if you save only 5 seconds into 20 questions, my dear guys, it comes out to be 100 seconds. That means 1 minute and 40 seconds. So if I say overall, at least you can save 2 minutes. And you all say, sir, I am unable to complete reading in 15 minutes, but I can do in 17 minutes. So save your 2 minutes here by this method. Finish your reading in 15 minutes. Thank you very much. Again, the only purpose of us being Dr. BCAM is to make your OET and NCLEX super easy. The only focus of this institute is how to make things easy. Even when I think about anything I learn new, even if it is swimming or anything, I just take my time to see how can I make it easy. And that is what I want to teach you. How can we make it easy? Thank you very much.